Dr. Alam, and I'm a board-certified psychiatrist, additionally trained in addictions, and had a 25-year history of doing research and developing new treatments in the field of neuroscience. I think, given my extensive background in research, medication and treatment development, brain stimulation, and interventional psychiatry, I tried to put all my experience together to provide a cutting-edge experience for our patients, which is not available in a very confusing field of mental health services right now. What brings people to treatment? What are they hoping to achieve? For example, some of our patients are simply here for some diagnostic clarification and helping them develop a cutting-edge treatment plan for them to go back. Others are coming for symptom management, and yet others may have a more complex presentation and need structured stabilization.